The thought is to take something, a chemical that would be a painkiller, and to put it in just the right spot so you can sort of break the spasm and the cascade of pain caused by nerves that have been irritated. That's the concept, right? Makes a lot of sense. Everyone would think you could do this elegantly. So how would a doctor truly do this? I took the same model and I just rebuilt it a little larger so you can see what it looks like. You all appreciate this. So what you do, you lie on your stomach. The doctor takes the needle. He goes through the area between these little bones in the back of your spine. Of course, the long needle goes into an area where you finally puncture beneath the skin and the tissue's nearby. But this is important. You'll notice I'm in a very special place now. I'm inside the skin, underneath where the bones are, inside the bone, but I'm not through this final little layer. Right? This is called the dura. This protects the spinal cord, which is all here. So your spinal cord, this layer, protective layer, and this needle has to be outside of those. If done correctly, it does this. You got all this stuff coming out and displaying where it needs to go, and everyone's happy. However, if the doctor goes just a little too deep, and that's not much, my friends, all of a sudden that goop, it gets on your spine. And it crumples those spinal nerves. All these things get crunched up together, and they begin to collapse down. That causes that shriveling that you saw in that video where the nerves have been damaged. It can even lead to paralysis. So I want to bring in rehab and pain researcher Dr. Jana Friedli, who has studied the effects of these epidural steroid shots. Dr. Friedli, are these shots as dangerous as this investigation appears to reveal?
Absolutely they are. In fact, we have new data at UW that suggests that they are even riskier than what's reported. So what we know is that these injections are riskier when they're performed by physicians who aren't well trained in safe techniques and who aren't cautious in their use.
And do they really work? I mean, how effective are they?
Most patients who get these injections are not going to improve with the injections. So what we know is that they are effective for short-term pain relief for people who have herniated discs with pinched nerves that cause radiating pain from the back down into the leg. But 75% of the people who get these injections don't have that condition, so they aren't likely to benefit.
Let me bring in Dr. Paul Lynch, who's performed about 5,000 of these injections, and that you believe that they're safe and effective. You just saw the investigation, some of this commentary. I'd love to hear your thoughts on this.
Yeah, I appreciate it, Dr. Oz. I think it's so important for your viewers and the people in the audience here today to understand a balanced approach to this, that there certainly are risks and we need to be aware, and it's so important that your doctor talks to you about the risks and benefit of any medical procedure you're thinking about. But at the same time, the thing that I think you realize is that anytime you go to see a physician, we're always balancing the risks and benefits of a possible alternative for you.
Dr. Lynch, is even one paralyzed patient worth it if we're not getting the benefits that we think we should be getting?
If you look at the data here, what's the alternative? We could put them on an opioid, a painkiller, a powerful pain medicine, but we know that that kills about 1 in 500 people who take pain pills. And that's not even a close assessment in my mind.
I'm more concerned that it's a palliative approach, that we're not getting the long-term benefits that I expected for the kinds of risks that we're talking about.
It's a great point, and we talk to patients about this all the time. Now, what I tell patients is if we can get you better even for 2 or 3 months and get you back into healthy life choices, physical therapy, maybe core strengthening, maybe weight loss and an exercise program, then that's a good thing for the patient, especially at this important crossroad.
So Sharon is joining us. She actually got some of these shots, and she believes that it helped her with her back pain. So, Sharon, after hearing the presentation today and the concerns that have been raised, would you still have gotten these epidural steroid shots?
Yes, because I was in such excruciating pain, Dr. Oz, that the other recommendations for relief of the lower back pain, I was not able to participate in.
Were you aware of the risks that were presented today before you had your own injection?
I was aware. It took me about 6 months to decide to actually do it. But the quality of my life, and I was unfunctionable. I couldn't pick up my children. I couldn't bend over to do simple things.
So for the many folks watching now who are in a lot of pain, and despite the concernings and misgivings that I think we've shared, still want to get an epidural steroid injection, what should they be looking for?
All right, well, 3 tips gleaned from talking with dozens of doctors. First of all, time. Give yourself at least 6 weeks of rest and physical therapy, and only consider an injection if you've seen 0 progress from those. Second, know your diagnosis. Know you're one of those people with a pinched nerve that actually will respond to this treatment. Usually it means there's pain radiating down your leg, and it's really the leg pain that responds, if I'm not mistaken. And finally, select your doctor carefully. Choose somebody board certified in a relevant specialty, lots of experience doing these, and avoid doctors who automatically say you need an entire series of these. Instead, choose somebody who says, let's just try one. see how we do.
So let me offer my bottom line thoughts, because I've gone through this process quite a bit. I agree with the 3 major pain societies that say these injections should only be used for a small set of patients with pain radiating towards their legs, as Elizabeth mentioned. That's not the majority of people who suffer from back pain. My biggest concern is that the results are short-term for the most part, and this procedure carries with it a lot of risk for that limited relief. So pick the procedure carefully.